All right, so I am here with Dr. Joey Fetta. And Dr. Fetta, I'm going to ask you about your new article, The Systematic Review and Critical Appraisal of Role Definition and Responsibility within the Concussion Management Team for Secondary Schools that you just published in the Journal of Neuroscience Nursing.
Yeah,
So I wanted to start out today by just asking you to tell us about what Return to Learn is all about and why it is important for nursing in the management of adolescents and young adults with concussion.
perfect. Thank you very much for taking the time to talk with me. Return to learn is something that's very important in my eyes and should be in a lot of other people's eyes. So the return to learn process is immediately following a sport or recreation related concussion, or any concussion for that matter, in school age students. So right now, where it is, the legislation really focuses on return to play after concussion. And there's very little mention about the process of returning to learn. Ultimately, in order to return to athletic competition, you need to be able to return to full academic workload first. However, the process behind that isn't necessarily spelled out for a lot of the members of the concussion management team. So the process involves bringing the student back to full academic workload, typically through an individualized step-by-step process to reintegrate them over the course of time. So because recovery after concussion can be highly variable from individual to individual based on the mechanism of injury, as well as certain underlying conditions that the student may have. It is a little bit difficult for people to kind of manage those symptoms in the school setting. But typically it starts with shortened days,
Mhm.
longer time to complete assignments, potentially different environments for the student to learn in. So it has less outside stimuli, maybe dimmer lights, quieter environments, things like that.
And
Um,
so Return to Learn kind of started out with a focus on athletic students or student athletes, but really has implications for all students
oh,
who
absolutely.
get concussion.
Concussions don't just happen in sports. You can have them by tripping and falling. Any trauma to the head can result in some level of concussion. So this does have implications for the entire population. But
And beyond even school nurses, it's really the nurses in primary care settings as well as specialty settings and really across the healthcare spectrum.
yeah, another one that comes to mind is occupational health. It's going to be very hard to get back to a regular working schedule if you're having some of the sequelae from concussion.
So in your own research, what have been some of the barriers that you've identified with implementation of Return to Learn?
Yeah, there have been several. So the biggest one that comes to me is communication. So when you are trying to help a student return to learn or return to academics, there are a number of different key stakeholders that play a big role in making sure that the student's needs are met. A couple of the heavy hitters, if you will, are going to be the school nurse, the athletic trainer, if it is a sport or recreation related concussion, coaches as well, and then administrators, principals, teachers as well. That's a bunch of different people that have many different hats that they wear in the secondary school setting. So having the ability to communicate openly and freely on top of their already numerous responsibilities is pretty difficult. Going along those same lines, there have been identified in a number of studies that there's confusions on role definitions. So what exactly is the school nurse to do in the return to learn process? How much does the teacher need to be involved, and how much does the athletic trainer really have to do with some of the academic things?
Great. And so can you give us just a couple of your high points, the key points that you learned through this systematic review and the critical appraisal in looking at role definitions and responsibilities of the concussion management team?
Yeah, the biggest finding was that there was a lack of consensus. So it really depends on different schools, different school districts, different states, and even different regions. So those themes of communication barriers and role definition confusion kind of proliferate throughout the entirety of the system. Because of the difference in legislation, a lot of the specifics on who is responsible for what come down to the different districts. And because of that independence in caring for these students in their return to learn, they vary quite largely. Some of the articles that we reviewed in the critical appraisal really focused on the role of the nurse and taking that leadership position. In over half of the articles, we identified that the nurse was responsible for the majority of the coordination, which I think is going to be the more typical way to go about reintegrating these students, because they have that critical nursing lens to identify the potential deficits, no matter how subtle they may be, especially with the symptoms of concussion. But the overall composition of the concussion management teams is varied as well. Some institutions have put the responsibility solely on the nurse. Some have put it solely on the athletic trainer, which identifies even bigger gaps in making sure that we, help all of the students, no matter the reason for their concussion.
Great, thank you so much. So this has really some big policy implications across the board at the federal level, state level, and at the local level in terms of really defining what these concussion management teams are doing, as well as the composition of them. And you can find out more in Dr. Fetta's article in the Journal of Neuroscience Nursing.